Hello everyone. I'm Dr. Jinali. I've been an assistant physiotherapist in Vadia since 2 years. And so basically, why do we need to understand why physical activity is important during this era, during this phase? Because we know that the pre-lockdown learning of children and adolescents have involved one-to-one interaction with the actually continuously involved in physical activity, in mental engagement also, and even while doing academic or extracurricular activities. But during this phase, children have been brought down physically as well as mentally also. So let's understand why is it important to engage in some kind of physical activity during the day and avoid any inactivity. So I would be covering why is regular physical activity recommended for children? What are the different types of play activities which are recommended for children across the varied age groups, and a take-home message for parents. So here we see there is a continuous link between the physical and the mental factors. As I say that because of the home confinement, because of the lockdown period, it has not only brought the children into boredom, but also there is anxiety, there are separation issues, there is a less of exposure with the environment. So there are behavioral problems, there's disturbed sleep, loneliness, which also has impact on the developmental status of the child. There is no engagement with the peer groups, obesity, and there is more of online video gaming and social media. So because of this, the health of the child is deteriorating. Now, because physical activity is recommended, is there are immediate health benefits, mental health benefits. It improves your energy intake, expenditure. It also improves the metabolic and the psychological profile, of course, because physical and mental health both are interrelated. Muscular strength, endurance, core stability, balance, and posture. And all these are very important because exercise itself says, as all of us know, it releases good hormones. So to maintain a proper balance between all these factors, these physiological factors, physical activity is important. So why now physical activity means
Jinali, are you there with us? As long as Jinali takes to come back, I will quickly refer to few questions which have been coming in from parents. So we have a question right now here for Dr. Meeti Manyar. And the question is that what is the new normal going to be for children who have had COVID in the past? Can they take part in the strenuous outdoor activities as before, given the fact that their lungs have been affected? Can you comment, Meeti? PT will take that question later for us. Jinali, are you ready for us?
Yes, I am. Can you see my screen?
Please continue. We can see you. Please continue.
Okay, can you see the presentation? The screen is on.
Please share your screen again, Dr. Jinali.
Yeah. Okay. So a structured physical activity program is recommended, which includes meditation, stretching sessions, educational games, functional exercises, climbing stairs, sit-ups, and push-up activities according to in a funny way, walking at home, aerobic fitness, cardio activities like cycling, home-based exercises, taking short breaks during the day. There is Lego therapy also, which is there. So there was one question in the live chat saying that if a child has autism spectrum, on the autism spectrum, so Lego therapy is one which will involve, because it involves a lot of eye-hand coordination as well as it involves strengthening of the shoulders as well, and the proximal and the distal muscles, warm up movements, and following an online exercise class. Now this has become actually a gold standard right now during this phase. Okay. So here, what kind of exercises can we use for different age groups? So starting from the infancy, we have a tummy time. The duration is 2 to 3 minutes for a newborn, 20 to 30 minutes for a 2-month-old child, 40 to 60 minutes for a 3-month-old child, 1 to 2 hours. That can be also intermittently varied with different positions as well. And for 6 months, it can be more than 2 hours, which will include functional activities. Then we also have physical activity for young people during COVID-19. It is a guideline from the WHO which says that online classes, online yoga, learning to juggle with the balls, building an obstacle course, playing with a football at home. So these are some important activities which can be done for children and also for adolescents according to their preferences. We also have now do engage. So these are just a list of exercises what we can do. So first of all is we engage in a variety of exercises at home with your family. Strength exercises, exercise with rope, broom, bottle, breathing exercises, stretching exercises. So there are belly breathing exercises which I'll share a photo quickly. There is avoid screen time post 8 p.m., which is one of the important concern. Maintain good hydration and avoid prolonged vigorous intensity exercises. There should be always low to moderate intensity exercises. Now people who are on Instagram or any other social media like Facebook, Twitter, mommy to veer with a underscore in between is a wonderful Instagram handle to follow, because it will involve all the exercises for a particular will also involve funny activities, and which will engage the child for a longer period of time in some physical activity rather than being on social media. So this is one kind of physical activity which can be done at home, which includes an obstacle course where the child is just trying to throw the ball, inside that bucket. So it involves a lot of eye-hand coordination, spatial orientation. That is one important. Second is breathing exercise. So here, for example, now here is a doll. So if if we are planning to do the breathing exercise, we can just keep the doll on our stomach, okay, and ask the child to breathe in and let the doll face out. So the doll should come out, the doll should expand outward. So it is also one way to ensure that the child is breathing correctly, and also it's a fun way where you can involve children of a particular age group. For example, if you are training a child of a 2-year-old or a 3-year-old, you can just have two children at one and the same time with proper guideline being followed at home, and use the doll also in varied activities, because this can be also fun. This is a very great activity which involves, this is also an obstacle course, uh, also involving a lot of time in this low to moderate intensity exercise. Now these are tips for parents where they can use these YouTube channels to see what are the online classes going on for exercise. Now the take home messages: you need to avoid inactivity through the day, because some activity is better than no activity. 60 minutes of low to moderate intensity of activity is beneficial. There are 5 minutes of outdoor activities which can be recommended with the appropriate times. For example, if outdoor activities are not possible, any balcony or near an open window area, that can also be taken as for any physical activity. Quickly, I just want to share one video where it's my neighbor's video where they have done. So they have been following it every day. The mother makes them do. Then you can see how the child is giving the instructions also.
Never mind the video. Could you please move ahead, Dr. Jinali?
So that's all I would like to share on the physical activity guidelines for children across varied age groups. And you can follow certain online classes also where they show different exercises. Thank you.
Thanks a lot, Jinali. So now we know how to get our children exercise, how to get the whole house on the field basically, and to keep everyone fit. Now let's listen from Jugal how to prevent the pathological side of children not being fit, how to prevent them from being obese. Jugal, please start. Thank you.
Yeah. Good afternoon, everyone. And I think we've had wonderful lectures and talks by my predecessors. And I'm just gonna take this a little forward. There are some things that have already been covered, which I'll rush through a little. And I'm gonna give you some tips and tricks how you can prevent obesity in your children. Obviously, these tricks are not just for COVID, because COVID is just one added factor. There are some things beyond that as well. So what are the risk factors for making your child obese? The most important, I feel, are the psychological, psychosocial, and the social, because the genetics and the metabolism, which we consider as biological, are something you're born with, which you may not be able to change. But what you can change as a parent for your kid is the health knowledge that you have and you impart to your kids, the eating behaviors that you have and your kids that you're going to develop with them, activity habits, the culture and the gender, I mean, the culture that we have at home and, as a society, the food policy of the family, which I feel is one of the most important things to prevent obesity, neighborhoods and schools, that is peer pressure, friends, these are something really important. And finally, stress and depression. What COVID-19 has done has just accelerated all of these together. What has happened is staying indoors a lot has led to a lot of stress and depression. I have seen a lot of infighting in the family that we've been observing as diabetologists, leading to high sugars. The same way we are looking at stress eating as one psychological or a psychiatric problem as well, which a lot of my, the next colleague of mine will help you and will, enlighten you about. So COVID-19 has started doing a lot of different things. Our eating behaviors have changed. Obviously, the exercise has gone down, as Jinali and Chintan were just mentioning, and even the food policy, because there were times when it was very difficult to get food. So what has happened is packed food was much more easily available, and packed food, and like Maggie had one of the largest sales in the lockdowns last year. So that itself, speaks volumes what we are doing in India for our own kitchen. Finally, coming to the weight and obesity, it's a very simple math. How much are you consuming and how much are you using it up? How much are you burning? It's just the imbalance which leads to the weight gain and the weight loss. And what we need to do is maintain a balanced weight, that is, make sure that the energy you're consuming and you're expending is somewhat the same. A simple things where we are going wrong. One is your Swiggy, your Zomato, they are coming with billion-dollar IPOs. And what is the reason? Because we are asking for more and more restaurant and fast foods. We are asking for more and more sweetened beverages. Eating frequency of such meals are going on increasing in every family. We are intake of sugar sweetened beverages, that is your colas and Pepsis and Diet Cokes, everything has been increasing. Fruit juice sales have also been on the highest. So what we need to do is make sure that we have fewer takeaway or fast food, maybe just once a week or something. Avoid all sugar sweetened juice and sugar sweetened things. We need to have smaller portion sizes, because what we've been observing is larger portion sizes leading to obesity. Finally, is there an association between energy dense food and obesity in adults? Yeah, that is very well known. But yeah, in children, we still don't have so much evidence. But I feel it's always and always better to avoid the high calorie snack food from the house. Take away the cookies and the chips and the cream. Use only low fat milk. Fruits and vegetables, I think Dr. Chobal mentioned it very clearly. You need to increase your fruit and vegetable consumption. What we've been seeing is the fruit and vegetable consumption in daily houses are going down. So we encourage at least 5 servings of food. Breakfast, the most important meal of the day. With COVID-19, what we've been observing in late nights have been increasing. People have been awake more in the night, whether playing games, talking, chatting, or working, and they start off their day late. Then they're skipping breakfast, and I think that is something really, really wrong. Obviously, the sleep part is also wrong, as well as skipping that breakfast is also wrong. What we need to do is eat a moderate breakfast every day in the morning, and that should be a combination of protein plus small amount of carbs. Coming to meal frequency, I feel the best way to do is 3 major meals and 1 or 2 additional healthy snack meals for your kid. I think this is how we've all been brought up with, that frequent feeding 2 hourly, 3 hourly with something or the other is not the right way to bring up a child and prevent obesity. Coming to exercise, I think a lot has been covered before. Just simple key takeaway points: decrease the time spent in sedentary activities, let them move out, let them not be glued to the television or their screens more than what is required, whether it's their school time, their tuition time, their classes time. Besides that, just try and avoid giving them too much of video watching or video games or something like that. And it has to start from the family itself, because what I've been seeing is the parents are glued to Netflix and Amazon Prime, and the kids are going to, they have no other option. If they don't have the toys, they're going to sit with the parents and just watch the same thing as well. So we need to start changing as parents as well, to inculcate that change in our kids as well. We need to accumulate at least 1 hour of physical activity daily for the kids. It can be just simple running around, pakda pakdi khelo, hide and seek khelo. These are very simple things. Chintan just showed you can just have a very small, slide there in the house, a small swimming pool. These are very simple things you can manage at home as well. You need to be physically active as a family. With lockdown, I know this becomes a little difficult, but once the lockdown eases, or if the restrictions are small, or if your building allows 1 hour in the day per flat, which a lot of guys have been doing, you should be doing that. You should be inculcating sports culture. I think this is what has been missing in our country. We do not give so much importance to sports. Not everyone needs to be a Sachin Tendulkar or a Virat Kohli, but everyone needs to start playing a sport. It really helps physically, mentally, and even from hormonal point of view as well. So let's be a good role model. You have to lead by example for your children. Give them a very structured meal and snack, and you need to plan their meal and snack beforehand. You have to prevent that grazing between the meals. So as a mother or as a father who's going to help the kid feed, just plan what they want to eat or what you want the child to be eating beforehand. Sometimes it may take 1 or 2 days before planning, okay, this is what I want to give, which is going to be healthy. Because if you're going to do last minute, the first thing that comes out is either the chips or the biscuit packet. Disband the clean plate club. I'm against food wasting, but I have been seeing this right from childhood a lot of times. Even if the child is full, just to clean up the plate, they are told, no, you have to finish it. And what it does, it leads to overeating. And once that overeating keeps on happening, you will finally accrue more calories and weight gain. And the last but not the least, please do not use the food as reward or punishment. It's so common that we see that, okay, today you're going to do this, then only I'll give you the burger or the pizza. If you're going to be able to, finish this, then I'll give you the burger or something like that. That needs to go off. You cannot use food as reward or punishment for your kids. That is not the right way to do it. So let's take these small little points and work on them as a family to help your kids more. The most important thing that I want to portray today is reading food labels. As a country, that is something we've been lacking initially in the form of the governance, which now has made it mandatory to put food labels on most of your food packets. And we as people have stopped reading or have not been reading them. So this is something what a food label looks like. So you have something on the top, which is the energy. Then you have the protein. Then you have the fat, which is total and saturated fat. The saturated fat in anything should be less than 3 grams per 100 grams. This is considered to be pretty good or pretty better. When it comes to carbohydrates, you need to understand there is total carbohydrate and sugars. Now, carbohydrate has complex sugars and simple sugars. This glucose or the lactose or the fructose that you know, that is simple sugar. Whereas the rest, what we've been knowing is complex sugar. But finally, all of them add up to be carbohydrates. So finally, they are sugars. But a lot of times we've been saying, no, sugar isme sirf 3.5 gram hai. But the carbohydrate is high. That itself also makes it a bad snacking choice. Okay. So the ideal is not more than 15 grams of sugar per 100 grams. That is something very important. Have something that gives you more of fiber and less of sodium. Sodium is nothing but your salt. So as before that, Dr. Chaubal mentioned, you should be having less than 5 grams of salt per day for your kids. And in these packed food, things which have less than 400 milligrams per 100 gram are the best ones that we can use. So I'll just give you one or two simple examples. And this is one of the very standard bread company that sells a multigrain bread, a whole wheat bread, and a white sandwich bread. And what you are seeing here is carbohydrate, which is 44 grams, 47 grams, and 51 grams. Whether the white bread or the multigrain bread or the whole wheat bread, there's very different, very small amount of difference in terms of the carbohydrate. If you look at the energy intake also, it's extremely small a difference. A lot of times, patients keep on asking me, should I eat the white bread, the brown bread, or the multigrain bread? After reading this or after knowing this, I think it's a no-brainer. Whatever bread you eat, it's the same. So rather try and avoid bread. And if you're going to eat it in a very small quantity. There is no point in having like 4 sandwiches for your dinner or 3 toasts for your breakfast, because finally this is a kind of a junk which we label as doctors. We really do not promote this bread culture that has been going on, which is really, really harmful to you. Finally, it's refined flour or maida, as we locally known is as. Similarly to your biscuits, if you look at the very famous digestive biscuits, the refined flour, that is the whole, the maida is just 90% of it. Okay. Then you obviously have the liquid glucose and milk solid. So at least he's putting sugar as glucose, and they are labeling sugars and carbohydrates differently. So this is a way of tricking you with the food labels as well. And then you have a very big Baba non-maida digestive biscuits being sold, which is made up of whole wheat flour, which you would feel is really, really good. But just look at the way they are renaming sugars as well. The fructo-oligosaccharides, the malt products, the corn flour, maltodextrin, these are nothing but sugars. So start reading these things very intelligently. This is the time we want you to use Google. This is where Google will help you. Finally, companies have become very intelligent in renaming sugars, but if you even start reading the labels, you'll understand. Now, looking at whole wheat flour, I thought this should be a good biscuit, but just look at the way they have done. They've made 2 biscuits of 25 grams is the serving size, whereas the digestive biscuits will give you per 100 grams. So you need to multiply this by 4. That means the non-maida digestive biscuits and digestive biscuits are equivalent in terms of your calories, your carbs, your proteins, and obviously these salt raising agents and these chemicals that are there. So what I would prefer is, as parents, make the healthy choices. Don't get these things at home. If you have these things at home, the baby or the kid is going to eat it. You are going to eat it. You are going to fall in. Even they are going to fall in eventually. These are not something extremely healthy. Yeah, once in a while you're snacking on them. It's a very different case altogether. But having them with every small snack or meal is not the right way to do it. So how should you know whether your child needs help? A lot of times, patients tell me, we didn't realize, otherwise we would have got him a little early. So it's a very simple thing which you can do at home. Measure the height and the weight of the baby or the child. Just calculate BMI, which is very easily available online. You can plot it on a chart. The Indian Academy of Pediatricians, has different charts for boys and girls for different age groups. where you can plot the height, the weight, and the BMI. And this is something we as doctors do it. And this is something I think parents who are educated can do it very easily. And you just need to see the centiles. These are the percentiles that we all understand. Beyond the orange line, he's overweight, and beyond the red line, he is obese. Obviously, we do have some amount of, factors, whether the US kid is definitely different than an Indian kid, and there are gradations to overweight, obesity, and severe obesity, which you can find really, really easily online. Just plot them, you realize where your kid stands today, and you may be able to understand that, yeah, now is the time I should start seeking help before it's too late for my kid. Finally, this is one thing you can always examine in your kid. If you don't have, the ability to take the height, weight because of the gadgets that you don't have, this is what we call as acanthosis nigricans. It is at the neck of the child. You will see this in a lot of adults with diabetes as well. This is basically just a dark, velvety, thick patch of skin in your neck fold. Once it's become like this indicates that you are in some form of hyperinsulinemia or insulin resistance, as we label it. That means you are getting into some form of trouble. A lot of times I get, references for my skin friends regarding this. The patient has come to them and they've realized that this is, probably related to the obesity or the sugar part of the story, and they do all the workup for the sugar and they send me. So this is also a very crude but a very important marker that you can just examine on a child, and if he has, please take them to your pediatrician, to your family doctor, at least to a doctor who will be able to just point out that, yeah, this needs a little bit of scrutiny, investigations, and it should be okay. So coming to the final take home points, finally, you are what you eat. Whatever you're putting in your mouth, this is what is going to define you, whether you're a kid or you're an adult. Please don't graze. You will become a cow. You're not cows. You're not supposed to graze. So have proper timed meals. 4 to 6 becomes more than enough. Clean the kitchen. If your eyes don't see, the mind doesn't know. That is what I believe. So if the chips is not there in the drawer, the chips are not going to be eaten. If the biscuits do not exist in the drawer, the child is not going to go and buy them from down. So I think you need to clean up the kitchen. Automatically, everything will start changing. Family and peer habits are most important. Kids are going to mirror their friends and family. They don't have that much intellect to develop their own habits. They're going to learn from you. They're going to learn from the friends. So you need to understand that y'all are going to set examples from there. So please have healthy habits yourself as parents, and maybe as the friends, and you will start seeing a real good change in your kids as well. And start reading food labels. I think as a country, this is what we've not been doing, and all the companies have taken us for a ride. So let's start reading food labels. There are really healthy stuff outside as well. Please start picking that up for your kids and for your family, rather than something that we were just discussing before. Thank you so much. In case you need to get in touch with me, these are the details. Thank you so much.
Thanks, Jugal. I think there were quite a few important points as you clearly made a gist of it at the end of your presentation. So we should read food labels, eat healthy, stay healthy, and yes, clean the kitchen but not the plate. Moving on to the next talk now. It's Miss Antara Sapre, who would